Have you ever met someone who can think outside the box, come up with wild ideas on the spot, or notice things others completely miss? What if I told you those could be signs of ADHD? Yep, ADHD isn't just about being distracted or impulsive, there's a whole other side to it that almost never gets talked about. And by the end of this video, I'll show you why some of the very things people see as weaknesses might actually be hidden strengths. But first, to really understand the full picture, we need to break down ADHD from every angle. What is it, what causes it, how it affects the brain, and what the latest science says. So stay with me because this journey might just change the way you see ADHD forever. Okay, before we dive in, I'm Dr. Ida Khan and you're watching Medico's Guide where we break down complex medical topics into clear evidence-based insights. Attention Deficit Hyperactivity Disorder or ADHD is one of the most common neurodevelopmental disorders in children, often continuing into adulthood. But ADHD isn't just about being overly energetic or distracted, it involves a complex set of symptoms that affect focus, impulse control, and behavior. Understanding ADHD is key as it can impact everything from school performance to relationships. History of ADHD. ADHD wasn't always recognized as a disorder. In the early 1900s, it was called minimal brain dysfunction, believed to be caused by brain damage. Over time, the focus shifted to cognitive and behavioral difficulties. By the 1960s, symptoms were better defined, and by the 1990s, ADHD was officially recognized as a medical condition, affecting both children and adults. This evolution from a vague label to a clear diagnosis has been shaped by ongoing research into the brain's role in ADHD. Now let's dive into risk factors of ADHD. Who's more likely to develop ADHD? Genetics top the list. If ADHD runs in the family, there's a greater chance a child may be diagnosed. Other risk factors include premature birth, low birth weight, and prenatal exposure to alcohol or tobacco. Environmental toxins such as lead found in old paint or contaminated water have also been linked to ADHD. Even high levels of early childhood stress or trauma can increase the risk. While these don't directly cause ADHD, they can increase vulnerability in children who are already genetically predisposed. Now let's take a look at pathophysiology. ADHD isn't just about behavior, it's rooted in the brain. Research shows that individuals with ADHD have differences in brain structure, particularly in areas involved in attention, decision making, and impulse control. The prefrontal cortex, which helps with planning and focus, may not function as efficiently in people with ADHD. Neurotransmitters like dopamine and norepinephrine, which regulate attention and impulse control, are also often imbalanced in people with ADHD. These neurological factors make it much harder for individuals to focus and control their actions, which leads to the symptoms we associate with the disorder. Let's discuss types of ADHD. ADHD comes in three distinct types, each presenting its own unique challenges. The first is ADHD inattentive type, where the primary symptom is difficulty focusing and paying attention. These individuals may be forgetful, disorganized, and prone to making careless mistakes. The second is ADHD hyperactive impulsive type, which is marked by excessive movement and impulsivity. People with this type may act without thinking and struggle to sit still. Lastly, there is ADHD combined type, which includes both inattention and hyperactivity or impulsivity. This is the most common type of ADHD, affecting many individuals who experience a mix of challenges. Symptoms of ADHD. ADHD symptoms can be categorized into two broad groups, inattention and hyperactivity or impulsivity. Inattention might look like forgetfulness, disorganization, or a tendency to be easily distracted. Children with ADHD might find it difficult to stay on task at school or follow through on instructions. On the other hand, hyperactivity and impulsivity involve fidgeting, difficulty remaining seated, and acting without thinking. Children may interrupt conversations, blurt out answers, or engage in risky behaviors. These symptoms can cause significant disruption in daily life, both for the individual and those around them. You might be thinking all of this applies only to children, but here's something crucial. ADHD doesn't disappear after childhood. For many, it continues into adulthood, but with different expressions. Hyperactivity may fade, but inattention, restlessness, and impulsivity can persist and disrupt work, relationships, and self esteem. The challenge: many adults don't realize they have ADHD. They have lived with the symptoms for years, often blaming themselves for being forgetful, disorganized, or easily distracted. Recognizing ADHD beyond childhood opens the door to real improvement. With proper diagnosis and treatment, whether it's therapy, medication, or lifestyle changes, adults can manage their symptoms and thrive. That's why it's so important to recognize ADHD at any age. Let's now explore how ADHD is actually diagnosed, whether in kids or adults. Diagnosing ADHD isn't just a matter of observing behavior, it requires a thorough evaluation by a healthcare professional. To diagnose ADHD, the symptoms must be persistent, lasting at least 6 months, and they need to cause significant problems in more than one area of life, like school, home, or social interactions. Doctors often use behavior rating scales and questionnaires, and they might look at family history to understand if there's a genetic link. Since no single test can diagnose ADHD, it's essential to rule out other potential causes of the symptoms. Differential diagnosis. Diagnosing ADHD isn't always straightforward because many other conditions share similar symptoms. Anxiety disorders, for example, can lead to trouble concentrating, which could be mistaken for ADHD. Depression is another condition that might cause issues with focus and memory. Additionally, learning disabilities, sleep disorders, and other neurological conditions can also mimic ADHD symptoms. This is why a comprehensive evaluation is critical to make sure we are addressing the right issues and providing the appropriate treatment. Now let's talk about complications. ADHD isn't just about having trouble paying attention or being hyper. If left unmanaged, it can create ripple effects in nearly every aspect of life. Children with ADHD often struggle in school due to poor focus and impulsive behavior, leading to lower academic achievement and self esteem. But it doesn't end there. Social relationships also take a hit. Kids may find it harder to make or keep friends, which can lead to isolation. As these children grow into adults, the complications evolve. They might face trouble holding down jobs, managing finances, or maintaining stable relationships. Research shows adults with ADHD have a higher risk of car accidents, substance abuse, and even legal problems. So, while ADHD might start as a childhood condition, its effects can be lifelong and far reaching if not properly managed. Now, comorbidities. ADHD rarely happens on its own. Many people with ADHD also face other challenges. For instance, oppositional defiant disorder (ODD) can cause defiant and hostile behavior, especially towards authority figures. Anxiety and depression are also common alongside ADHD, which makes it important to treat both ADHD and these mental health issues. Some individuals with ADHD may also struggle with substance use, using alcohol or drugs to cope. On top of that, learning disabilities and tic disorders can make things even more difficult. Okay, let's dive into treatment overview. Managing ADHD involves a combination of medication, behavioral therapy, and lifestyle changes. Medications like stimulants, including Adderall and Ritalin, are commonly prescribed to help improve focus and control impulses. For some, non stimulant medications like Strattera may be more appropriate. Behavioral therapy, including cognitive behavioral therapy, which is CBT, helps individuals manage emotional and social challenges. But it doesn't stop there. Effective treatment also involves establishing routines, improving organizational skills, and offering support at school and home. ADHD medications. Medication plays a central role in managing ADHD. The most common used medications are stimulants like methylphenidate and amphetamines. These help by increasing the levels of dopamine and norepinephrine in the brain, improving focus and self control. There are also non-stimulant options such as atomoxetine, guanfacine, and clonidine, which may be better suited for some individuals, especially if stimulants cause side effects. While medications don't cure ADHD, they make a significant difference in day to day functioning when used correctly. Now, behavioral therapy focuses on helping both the individual and their family manage ADHD symptoms. Techniques like CBT, social skills training, and school accommodations are effective in improving function and self control. In school, children with ADHD face significant academic and behavioral challenges. Providing structured support and tools like visual aids and fidget toys can help them manage their symptoms and succeed in school. ADHD affects not just the individual but the entire family. Parents often face challenges in maintaining discipline while siblings adjust to family dynamics. Despite these challenges, many children with ADHD also have remarkable strengths, which we'll discuss later in a bit more detail. Now, relationship between ADHD and self-esteem. Children with ADHD often face challenges in school and social settings, which can lead to a lack of confidence. Fostering a supportive environment and focusing on strengths can help build self-esteem and confidence. Now let's take a look at ADHD prognosis. ADHD is a lifelong condition, but that doesn't mean life is always difficult for those affected. While some symptoms may lessen with age, many individuals continue to experience challenges throughout adulthood. In fact, studies show that adults with ADHD are at a higher risk for other conditions like anxiety, depression, and substance misuse. However, with the right treatment, many people with ADHD lead successful lives, excelling in fields that require creativity, flexibility, and out of the box thinking. It's also important to note that individuals with ADHD may have a slightly reduced life expectancy due to associated risks like smoking or risky behaviors. But with support, many can manage these risks. Now let's discuss about ADHD prevention. There is no guaranteed way to prevent ADHD, but some steps may reduce the risk. During pregnancy, it's crucial to avoid smoking, drinking alcohol, or using illicit drugs, all of which can affect the baby's developing brain. Limiting a young child's exposure to environmental toxins like lead and secondhand smoke is also important. While we can't eliminate every risk, creating a healthy, supportive environment early on lays a strong foundation for brain development. Now, research directions. This section highlights where ADHD research is headed. Scientists are studying how brain chemicals like dopamine function differently using imaging tools like fMRI, which is functional magnetic resonance imaging. Genetic research is uncovering inherited patterns, which may lead to personalized treatments. They're also exploring biomarkers, biological signals that could make diagnosis faster and more accurate. Non drug therapies like neurofeedback, digital tools, and brain training are gaining attention too. And there's a shift towards recognizing strengths like creativity and quick thinking, traits often seen in people with ADHD. Now let's focus our attention towards the most awaited part of the video, that is positive traits of the ADHD. When we think of ADHD, we often focus on the struggles. But there's another side to the story. Many individuals with ADHD also show some pretty remarkable strengths. For instance, creativity is a big one. People with ADHD tend to perform well in tasks that involve divergent thinking. That's the ability to think outside the box and generate fresh, original ideas. Then there's hyperfocus. While distractibility is common in ADHD, many people also experience intense focus when working on something they're passionate about, whether it's art, gaming, coding, or storytelling. High energy and enthusiasm are also part of the mix. In fast paced or dynamic environments, this trait can actually be a huge advantage. We also see a strong entrepreneurial spirit in many people with ADHD. That willingness to take risks, which can be challenging in some situations, actually fuels innovation and bold decision making. On top of that, a lot of people with ADHD are highly intuitive and spontaneous, which can help them adapt quickly and bring unique perspectives to the table. And lastly, despite difficulties with emotional regulation, many individuals with the ADHD report having deep empathy and emotional awareness, which can strengthen their relationships. So, while ADHD does present real challenges, it's important to recognize the full picture, including strengths that come with it. Okay, now let's conclude our discussion here. ADHD is a complex disorder that affects millions of people worldwide. But with early diagnosis and the right treatment, individuals can lead successful, fulfilling lives. It's a lifelong condition, but it doesn't have to define you. Whether through medication, therapy, or lifestyle changes, people with ADHD can learn to manage their symptoms and thrive. By spreading awareness, we can reduce the stigma and create a supportive environment where everyone, no matter their challenges, can succeed. So remember, ADHD is not a deficit, it's just a different way of experiencing the world. And that wraps up a deep dive into ADHD, from its causes and symptoms to diagnosis, treatment, and even some surprising strengths people with ADHD may have. If this video helped you or if you learned something new, don't forget to like, share, and subscribe to Medico's Guide. It really supports the channel and helps me keep creating high quality medical content just for you. Drop a comment below if you have any questions or tell me what topic you'd like to explore next. I read every one of them. And as always, stay curious, stay kind, and stay tuned because learning never stops. See you in the next video. Until then, take care.